This vivacious grandmother, Sheila Engdahl, has always been the life of the party.
So we said, this guy is good for that.
But 10 months ago, she was diagnosed with ALS, an incurable neurological disorder that destroys the body but leaves the brain untouched. With the moral support of her friend Sue McGovern, she agreed to talk to me.
I was devastated that I had, and devastated there was no treatment for it. But
now she has a page on a social network site, but she's not keeping up with friends. She's trying to find a treatment for ALS on a website called Patients Like Me. Conventional wisdom, doctors and healthcare professionals know diseases best, but patients like Sheila know what it's like to live with a devastating illness, and they're not only sharing their experiences, but also driving research into new treatments.
They come home from the doctor, and they might have answered the medical questions well, but the meaning and its impact in their life and what to do with the issues of dealing with an illness are not answered, and they come seeking those answers.
James Haywood and his brother Benjamin founded the website. Their idea? Take the medical records of ALS patients like Sheila, as well as patients with other diseases, and make the information available to everyone else on the site. The goal of this experiment in real time? Revolutionize the way patients get their information.
The first thing you get is really how you're doing relative to the rest of the world. So is my disease progressing fast or slow? You know, what treatments am I on relative to other patients? And so immediately patients know where they stand in the world.
Last year, a small study found that 16 ALS patients benefited by using the drug lithium. Once word got out to the 2,800 people in the ALS community on the website, patients started trying it. A conventional clinical trial that might take years to organize was up and running in a matter of days. The Haywood brothers know from personal experience. Their brother Stephen was diagnosed with ALS at age 29.
The first thing Jamie told me about Belinda.
The research these two MIT-trained engineers launched to try and save his life was the subject of a documentary film and led to the creation of the website. Stephen died 2 years ago.
This is a patient icon.
But his web page is still active, and patients are still able to learn from him.
The collective wisdom of hundreds and thousands of patients really is smarter than any one person, no matter how well resourced you are.
Even as she feels herself weakening, Sheila has hope that the strength of shared experiences will speed the pace of research.
Do you think that something will come about to help you?
I do.
In your lifetime?
Yeah, I do.
Dr. Sanjay Gupta, CBS News, Hull, Massachusetts.